The Food and Drug Administration updated its mammography regulations, and now facilities will have to notify patients about the density of their breasts. For more information on the subject, we bring in Dr. Parisa Lotfi, a breast imaging specialist and radiologist at Yale Cancer Center. Doctor, thanks for your time tonight. Let's start with this, please. Connecticut already implements this mandate, but what will this mean now for women for the rest of the country?
Thank you for having me. Yes, Connecticut for over a decade has been informing women if they have dense breasts. And now the rest of the nation can also benefit from this information. So women will know when they receive a mammogram if they have dense breasts, which can not only mask cancer, but also elevate their breast cancer risk. And when they have this information, they can share it with their providers who also know this information. It's stated in the report, and come up with a comprehensive plan for breast cancer detection. Density, as well as other risks, may qualify a patient for additional screening, which could be supplemented with an ultrasound or an MRI, depending on a woman's risk. So knowledge is power. It's great for women to know this information.
Doctor, what is the difference in terms of cancer risk for women who have dense breasts versus women who don't have dense breasts?
Women with dense breasts have a higher risk of developing breast cancer. It's somewhat equivalent to having a family history of breast cancer.
And
so it's really important for women to know this information.
Absolutely. And doctor, you mentioned ultrasound before. We've talked about mammograms. What more can be done to catch breast cancer early? What would you recommend for women out there listening tonight, whether they have dense breasts or not?
So first of all, women need to get their mammograms. They need to be aware of the recommendations for screening intervals depending on the age, race, ethnicity. Then they need to know if they're dense or not, if they have dense breast or not. They also need to be really aware of their breasts. They need to know what they look like, and if there's anything that's changing about their appearance of the breast, if they have any symptoms, if they have any signs of cancer, definitely don't assume that a negative mammogram would have picked up any cancer, because we know definitely the masking effect makes mammography limited in women who have dense breasts. Bring those concerns to your physician, and we can get additional testing, which can include a diagnostic mammogram, ultrasound, and or MRI for further evaluation. Also, if you're going to have a mammogram, make sure it's a 3D mammogram or tomosynthesis, as it has a slightly higher cancer detection rate.
Dr. Parisa Lotfi from Yale Cancer Center, thank you so much for your time and expertise tonight. Appreciate it.
You're welcome. Thank you for having me.